Hi, CHW Hub. It's me, Nurse Sarah, and today we're going to tackle another chronic medical issue that a lot of people experience, and that's high cholesterol. So I'm going to go ahead and share my screen so that we can get started. So by the end of this presentation, you should be able to describe the types of cholesterol, identify risk factors for high cholesterol, list the consequences of high cholesterol, and explain measures to prevent high cholesterol. When we discuss cholesterol in the medical sense, we're really talking about blood cholesterol. And this is just fatty deposits in the blood. Cholesterol is necessary for completing bodily functions like making hormones and digesting fatty foods. Almost 40% of adults in America have high cholesterol, and this puts them at risk for other medical conditions and events. There are no signs or symptoms of high cholesterol, so it really relies on the patient talking to their doctor and having their blood levels checked. The CDC recommends that all healthy adults have their blood cholesterol checked at least once every 4 to 6 years. Children and teens also need to have their cholesterol checked once between ages 9 and 11, and then again between ages 17 and 21. If a patient has another chronic health condition like diabetes or heart disease, or if they have a family history of high cholesterol, their doctor will want to check their levels more often. And this is information that we should be passing along to our patients. When people get their blood cholesterol checked, there are a few levels that they will see on their profile. And the first one is called high density lipoproteins, or HDLs. I like to think that the H stands for happy. And these are your good cholesterol. So you want to have more HDLs. You want this value to be higher. People assigned male at birth should aim for an HDL level over 40 milligrams per deciliter. And people assigned female at birth should aim for at least 50 milligrams per deciliter. Next are your low density lipoproteins, or LDLs. And I always say that the L stands for lousy. You don't want to have as many of these. So providers like to see a number under 100 for LDLs. Triglycerides are the blood cholesterol level that's the most sensitive to diet and exercise change. Your body uses triglycerides for energy, and you want this level to stay below 150. And lastly is your total cholesterol. And as you might assume, it is a measure of all of the cholesterol in your blood based on your HDL, LDLs, and triglycerides. And you want this number to be under 200. All right, now, did these pictures look familiar? Because they should if you watched the stroke presentation from a few weeks ago. And if you have not watched that yet, be sure to check it out after this because it kind of brings all of this together. High cholesterol can lead to chronic conditions like heart disease. Having high cholesterol actually doubles your risk for heart disease. One thing to know about cholesterol is that it's sticky and it likes to cling to things. If you remember from the stroke lecture, when our cholesterol is too high, it starts to build up and create these fatty plaques inside of our blood vessels. And they really love to create these plaques at these forks in the road, which they call bifurcations. If you see here in the picture on the left, this fatty plaque is just starting to form. So you can see those blood cells are still flowing. It's not like completely blocked yet. But in the picture on the right, this plaque is either built up so big or it's traveled from another location and gotten stuck, and it has completely blocked this blood vessel. And that means that blood can't flow past that point. Remember, when we don't have enough blood going to important places like the heart or the brain, we end up with heart attack and stroke. And both of these events are medical emergency and require immediate medical attention. There are several risk factors for high cholesterol, some of which you can change and some of which you can't change. Again, you'll see that these lists look very similar to the risk factors for stroke. Smoking damages your blood vessels, and that makes them really vulnerable to developing those fatty plaques. In a lot of cases, the damage from smoking makes it easier for those fatty deposits to actually get underneath the lining of the blood vessel. And again, a diet that's high in saturated fat and trans fat contributes to high cholesterol and not getting enough physical activity. And then there are the factors that you can't change. So as we age, our body just has more difficulty clearing cholesterol out of our system. So the risk for high cholesterol increases as we age. Up until menopause, women typically have lower levels of LDLs or the lousy cholesterol. And until around age 45 or 55, excuse me, men have lower levels of HDLs or that happy cholesterol. Um, and then family history of high cholesterol can be a real predictor for someone to have high cholesterol. And here we're talking about direct family, so like a parent or a grandparent. There we go. Okay. When we're thinking about preventing high cholesterol, much like with any other health condition, we are looking at those factors that we can change. So choosing a diet that is low in saturated fats and trans fats will help in managing cholesterol. Physical activity can also help in lowering your LDLs and triglycerides and in increasing your HDLs. And as a reminder, as always, adults should get at least 2 hours and 30 minutes of intentional movement per week. And children and teens should get at least 1 hour of physical activity every day. Like I mentioned, smoking causes damage to your blood vessels, which makes it easier for those fatty plaques to develop. So decreasing smoking or quitting entirely will help in preventing high cholesterol. And here are some links to resources that we can provide our patients, both here at Rush in the community and online. At Rush, we have our own nutrition and wellness center and smoking cessation programs. The YMCA also offers low-cost health and wellness services, including health education, fitness classes, healthy eating and cooking classes, and smoking cessation classes. And this link that's on this page will take our patients to a page that allows them to find the closest YMCA to where they live. And then the American Heart Association has a really well done virtual education program about managing your own cholesterol that can be done at your own pace. And lastly, we're all going to take a pop quiz together. So let me just unshare my screen and reshare my screen here. All right, let's see if we can get it to work. Okay. Here we go. So, cholesterol fact or fiction. When you have too much cholesterol over time, blank can build up in your arteries and make it hard for blood to flow to your heart and brain. Red blood cells, white blood cells, plaque, or platelets. So we know that when you have too much cholesterol over time, you get fatty plaques that can build up in your arteries. So we're going to choose plaque. Correct. Next, we have two main types of blood cholesterol. Which type is considered good cholesterol? So we have our happy cholesterol, our lousy cholesterol, our triglycerides, and our total cholesterol. Good is our happy cholesterol, so HDLs. People with high blood cholesterol have about blank the risk for heart disease that people with ideal levels have. So we talked about how high cholesterol can double your risk for heart disease. So twice. Most adults need to have their cholesterol checked every how many years? We talked about it a few slides ago. Is it 1 to 3 years, 4 to 6 years, 7 to 9 years, or 10 to 12 years? It's going to be 4 to 6 years. And the last question, your cholesterol levels are affected by how much physical activity you get, unhealthy diet, your genes, or all of the above. And here we have a good combination of some factors that you can change and you can't change. It is all of the above. And you got a perfect score. Congratulations. All right, everyone. I hope that you have a wonderful rest of your week. And as always, stay well.